Hello, Kern County, and welcome to another episode of Kern Living. I'm your host, Ryan Nelson, and today we're back with our family members from Omni Family Health. I'm going to let my guest introduce himself.
Hi, my name is Dr. Munnainathan. I'm a family physician and associate medical director with Omni Family Health.
Awesome. So now today we're here to talk about diabetes. What exactly is diabetes? Because we were talking about it earlier and I had the wrong term for it, so let's have a professional answer.
No worries. To keep it simple, diabetes is when you have too much sugar in your blood. Normally there needs to be a certain amount of sugar so that your body can use it for energy. But when after a meal, your sugar levels do go up. When that happens, your body releases insulin, which gets rid of that sugar. Usually it puts it in the muscles so it can be used as energy. But what happens is when you consistently eat a lot or the sugar becomes fat because there's just too much, the fat can interfere with what the insulin does and lead to extreme high levels of sugar, which can lead to complications.
Wow. Now, who can get diabetes? Everybody?
Pretty much everybody, yeah. Whether you're a child, pregnant, male, female, 65, 85, anybody. But there are certain people with higher risk factors. So family history of diabetes, they're more prone to getting diabetes. But also there are modifiable risk factors. So if you're someone who eats pretty unhealthy, lives a pretty sedentary lifestyle, has a lot of stress in their life, they're more likely to get diabetes.
Now, to manage diabetes, does somebody have to take medicine to alter their lifestyle?
Sure, and it depends on what stage of diabetes they're in. If they're in the very early stages when the number is not too high, we might recommend some lifestyle changes for them, eating healthier and maybe more activity. But as the levels go higher and higher, we do recommend medications and possibly insulin, depending on what stage and what type of diabetes you have. But together, you can really bring it under control.
Now, how can you lower your chances of getting diabetes?
So reducing those risk factors, so eating healthy, eating more whole foods, plant-based, cutting back on the processed, refined foods like chips and cookies and candy and sodas, and exercising more. Most adults need at least 30 minutes of exercise 5 days a week at moderate intensity. If you have concerns about whether you can exercise or not, talk to one of your providers. Managing your stress is really important, whether it's self-care, mindfulness, meditation, or even getting therapy. And then the most important thing for some people is to not drink or smoke, because that leads to very high risk of getting diabetes. If you do all this, then it's a very good chance that you can avoid getting diabetes. But if you already have diabetes, doing these will help kind of bring your body back to how it was before diabetes and hopefully get rid of that for you.
Wow, thank you so much for all of that information. I just got schooled. I learned a whole lot. Now, if anybody wants to find any more information, where can they go?
They can reach out to us. They can schedule an appointment with their provider. We do have a Facebook page where we have other topics, diabetes-related topics as well. If you already have diabetes, it's important to get your A1C checked. I think it's now the end of the year, so if you haven't gotten that checked this year, it's important to come in for that. But we're always here to answer any questions you might have.
Awesome. Well, thank you so much for answering a lot of the questions that I had in my head that I wasn't saying, but you were just spot on every single time. Thank you so much. Make sure you follow us on social media at Kern Living on Facebook, Instagram. We're everywhere. Make sure you follow myself as well at Ryan Nelson 23. I'm going to start eating better because I just learned something new today, and I hope you do as well. I'll see you next time.